Welcome to ABA Inside Track, the podcast that's like reading in your car, but safer. I'm your host, Robert Perry Cruz, and I'm joined by my fabulous co-hosts.
Hello there, Robert Perry Cruz. This is one of your co-hosts, Jackie McDonald.
And it's me, Diana.
Did I mention you both were fabulous? I think I forgot.
No, usually you do give us a lot of compliments, but this time,
I apologize.
None.
I'm
Zero compliments.
I'm a little off on my chain of introductions. Well, welcome everyone.
And my co-host, just my plain old ordinary co-host.
It's been one of those days, you know. I'm not feeling hyperbolic in my introductions. Oh, but you know what? I saved it. I have to save the hyperbole.
There we go. Okay.
Because on this podcast about behavior analysis and behavior analytic research, in which every week we pick a topic related to the field and discuss relevant research to that topic, I have to save my hyperbole because we have not one, but two guests joining us tonight to talk about this episode's topic, which are advances in treatment for autistic adults. And those two very special guests are Dr. Sungwoo Kahng and Dr. Christopher Manente. Sungwoo, Chris, thank you so much for coming on the show. I saved my hyperbole for your amazing achievements in research that you'll be discussing tonight.
Thanks very much. I'm very flattered.
Same here. Good to be here.
Oh boy. So we are very excited. We've done a few episodes across the length of the show on services and treatment for adults. We had one not too long ago, but it is one of those topics, and you mentioned it in the 3 research papers we'll be discussing tonight, that just always feels like it's not getting as much attention as it should be. And there are so many questions about generality, about which treatments will or will not work for the population, given the special needs of adults versus, say, teenagers or children, that we're very, very happy to have a chance to continue that conversation.
Disparity in resources as well.
Yes,
I would say.
Yes.
Are you referencing our vocational objectives episode?
Sure. That's the one, probably.
Probably the one.
We have a lot. That
was a recent episode, but it also goes all the way back to episodes 13 and 14. Mm-hmm. We talked about transitioning to adulthood too, and one of those is with Dr. Peter Gerhardt. Mm-hmm. So if anyone wants to do a rewind and then a fast forward, not a bad idea.
You could certainly do that, yeah.
Yeah, and Peter actually started the first adult service program at Rutgers University. He started the Douglas Adult Program at the Douglas Developmental Disability Center a few decades ago. So definitely someone that, I'm very flattered to follow on your podcast.
I think you're aging Peter a couple decades ago.
He doesn't mind.
Oh boy. So since we've got two guests, we want to make sure we get two special introductions. So for listeners who may not know your research or may, only have a passing, awareness of your research, please tell us a little bit about yourselves.
Thanks again for having me. And by the way, I understand this is episode 201 for you guys. So congratulations. That is amazing.
Thank you.
Thank you.
So well done. But so I am Dr. Sungwoo Kahng, as you mentioned, and I'm faculty here at Rutgers University in the Graduate School of Applied and Professional Psychology, or also known as GAZAP. I've been in the field for quite some time, not as long as Peter Gerhardt, but pretty close. I went to graduate school at the University of Florida. I worked at the Kennedy Krieger Institute for a long time, and that was home for a while. And then I went to the Midwest, the University of Missouri, started a graduate program in ABA, and then came back east to Rutgers University, where I've also worked on developing new graduate programs. Some of my other responsibilities, I'm also the chair of our department, and I also have the honor and pleasure of serving as the president of the board of directors for the BACB.
Is that a new organization?
You're not busy at all.
I don't know if I've heard about that one.
Yeah, they're small and they're growing. They're trying hard.
Well, it is a real pleasure to have you, Sungwoo. Thank you. Chris, it sounds like you're up.
Boy, that's a hard intro to follow. So I am Dr. Christopher Manente, and I'm the founding executive director of the Rutgers Center for Adult Autism Services. I actually came to adult services through somewhat of an indirect path. I knew I wanted to help people who had difficulty learning through the traditional means. And when I got off active duty military, I landed at Rutgers as an undergraduate psychology student and happened to sign up for a little course called Fieldwork in Autism, which brought me to the Douglas Developmental Disability Center, which was actually the first university-based school to practice ABA serving kids with autism, which was founded way back in 1972. So a long history of work in ABA and autism at Rutgers. And, I went to the DDDC and really just got bitten by the ABA bug, needed to know everything I could, learn about it, and also got really interested in the treatment of a severe and complex challenging behavior there. So just took every job I could and took every class and went to every workshop and, fast forward and, the RCAS exists, and it's an organization dedicated explicitly to supporting adults, college students, and adults with significant support needs and everyone in between. And we have multiple programs that, serve different needs for different folks.
Very nice. So we're going to be talking about 3 research articles related to some of the work going on there, some of the research happening, one of which was, when we got it, it was kind of in prep, but is it moving along still?
Is it the job interview one?
Yes.
Yeah.
Yep, that is still under review.
We liked it a lot. So listeners, you're just going to have to enjoy listening to us talk about it because you won't be able to see it quite yet. And then later you'll see it and go, oh, whoa, I heard about that one already.
All right, so we have 3 articles that we're going to talk about tonight. The first one is titled Differential Reinforcement to Decrease Stereotypy Exhibited by an Adult with Autism Spectrum Disorder by Butler, Kobilars, Zaki Scarpa, LaRue, Manente, and Kahng. That is in Behavioral Interventions 2021. Next up, Treatment of Food Selectivity in an Adult with Autism Spectrum Disorder by Poblitsky, Yanovchik, Zaki Scarpa, LaRue, Manente, and Kahng. That was in Behavior Analysis and Practice 2021. And then this one, yeah, it's a good year. Fine vintage. And then this one is An Individualized Approach to Teaching Adults with Autism to Successfully Navigate Job Interviews via Remote Instruction. And this is the one that is under review. And it's by Kahng, Butler, Cronfley, Zaki Scarpa, Baragi, and Scott.
Excellent. All right. So while I think, when we get into the articles, we can talk about some of the, the individual treatment plans and the results. I think one of the bigger pictures, and we're so glad to have both of you here to talk about this, is what is the status these days on research for adults with disabilities? Because in some ways, some of these papers feel like, here's a treatment that has been researched to death among these populations, and we thought maybe adults might benefit from this too. Is that kind of your thought process in the, at the adult center in terms of, we've got to be testing some of these treatments. They're evidence-based, but we don't know about the generality to this population. Am I oversimplifying the issue, or is it really that? That's what it is. No,
so I'll talk about the research perspective, and Chris, I think, can provide like a much better description of kind of like the overall state of autism in adults. But from the research perspective, I think you're spot on. Those first 2 projects they're essentially case reports. And they came out of, obviously a clinical need. There were some challenging issues that interfered with these individuals' ability to be independent. But what we also found is that, when looking at the adult population, there really is very, very little research. So in a way, it's, it's me being lazy and saying, hey, let's just do this stuff that we already know a lot about and start applying it to, supporting adults with autism. But I think, from my perspective, I'm also looking at, kind of like a bigger perspective is, like there are so many more supports for younger children with autism. And that's in part driven by all the research that's available out there. And what I'm hoping is that if we can get enough people, like other researchers on board, so that we are also now demonstrating this mountains of research with adults, then we can start, kind of changing that discussion so that there's more support based on evidence for adults as well.
And Chris, from kind of the treatment standpoint, is it sort of the same thing of, we have all this evidence, we've got to make sure it's going to work for a population that is, not really where most of the resources are going these days, right?
Yeah, and while so the basic principles of ABA, right, obviously apply, universally in, the development of different treatment strategies. DRO implemented in a session-based format in, the context of a highly controlled school classroom is not equivalent to a DRO implemented across community settings throughout an entire day in a dynamic, messy, natural environment, right? So I think it's a bit of an oversimplification for sure to say, hey, DRO is something that's been researched to death with children, in highly controlled environments. Is it just like, let's show it also works? So I think, the devil's in the details for sure. And, I don't think, we'd be behavior analysts if we just assumed that, the ABA-derived strategies that have been shown to work for one population would automatically be effective with another in an entirely different set of contexts.
Now, when we talk about kind of challenges for treatment of adults, whether it's from a research perspective, from a clinician's perspective, I know for me, it seems like one of the bigger challenges would be that you are going to be working with a population that has more opportunity to self-advocate in a way that, while I think, folks looking into, say, like trauma-informed ABA might tell you, well, we should have been doing this since day one. For some people might be like, whoa, you're going to tell me that you don't like my great treatment idea, but I've got so much research to back it up. What has been the challenge you've seen in making sure that not only do you have a treatment that's evidence-based, but it's also going to pass the smell test of your client, who potentially is going to have very different needs than a population that many of us have probably been training with for longer than adults?
Well, so that's a great point. And I think, there's obviously the issue of consent and assent, right? And that's been a discussion that we've been having recently. And I think, in terms of the population at RCAS, it's a mix. There are students who have their college degrees and also have a diagnosis with autism, right? But then there are also other people kind of on the other end of that continuum who are perhaps nonverbal or minimally verbal and need a lot more support. And so they can't necessarily provide consent. Perhaps they could provide assent. And so I think that's a bit of the part of the challenge, is kind of, working with that group where it is a very diverse group of individuals there. And there have been times where, those people who could provide consent said they don't want to do it, and we can't make them, right? Mm-hmm. I remember this one particular time we were trying to do a functional analysis with somebody who engaged in pretty severe aggressions, but he was also very excellent verbal behavior skills. And he kept questioning us, like, what are you doing? Are you studying me? Like, why are you guys there? And we just couldn't do the functional analysis because it was just such a weird arrangement for him there. So I think that's an example of some of the challenges that we face.
Mm-hmm. And Sungwoo, just because some of our listeners are students, and I think a lot of the time students have a really hard time between the distinction of consent and assent, can you kind of give us what the differences are between those two, just so when people are listening, they know exactly what we're talking about?
Yeah, so a consent would be that, someone has, I guess, the means to agree to participate, right? But there are certain, I guess, groups or subsets of groups that just don't have the means, right? Children, for example, for the most part, can't consent to participate in studies there. But you can still get their assent, which means that they will agree to participate. So same goes for, adults with autism who might be minimally verbal, right? So, they may not necessarily have the means to consent, but we can still involve them in the process and ask for their assent.
Thanks.
The broader response too is that, it should come as no surprise to anyone, on the podcast tonight or anyone listening, that behavior analysts and ABA as a field, is suffering from a bit of an optics and reputation problem amongst adults with autism and self-advocates in particular. So I think it's becoming more and more common for behavior analysts to be accused of doing things to adults with autism and not working with adults with autism. And so I think that's, a big challenge that Sungwoo and I and our whole team at the RCAS face, is just ensuring that we're wrestling with, kind of this difficult need to balance helping people succeed in, the world the way it is today, where it's not really structured in a way that, would lead to a high likelihood of success for most people with autism, but also, honoring individual rights to personal liberty and preferences and, the opportunity to have some agency in, the direction of their own life and their experiences from day to day, even if they are being supported by clinicians who sometimes, might think they know best.
With RCAS, we have a weekly clinical peer review where we're going over data, obviously to inform practice there. And I think, one of the questions that always comes up is, well, why do you find it necessary to treat that behavior, right? So, and oftentimes that's related to stereotypies, right? Obviously, if it's aggressions, that's a problem. If it's self-injurious behavior, that's a problem. But stereotypy, I think, is when we ask that question most often. And he's like, why are you treating it? Is it necessary? Like what is the harm caused by that stereotypy there? So I think that's really important for everybody to take in consideration, obviously, is, do we need to treat these behaviors? Especially given in light of all the criticism that ABA has been taking recently.
Mm-hmm.
Yeah, Mike, where's the line with stereotypy in particular? So when can stereotypy actually be functional and an adaptive behavior even? And when does it become maladaptive? And, who gets to decide, right? There are a lot of adults on the spectrum who report that engaging in stereotypy is really beneficial for them, in a lot of ways. And again, it does become complicated to develop kind of rules that staff can use to make consistent decisions as to, what behavior should be targeted for reduction.
Mm-hmm. Oh, Chris, that kind of makes me think about, kind of another question I had in terms of for clinicians, they're saying maybe working in the center. And I don't know if maybe this is part of the design of the center. You get people in and that they want to work with adults and it's the first population. But I mean, have you found it ever challenging to work with individuals who are coming from work with adolescents or elementary school students or elementary school age children? Because I mean, I know for me, it's like, oh, ABA, that works. We're all humans. It's going to be great. It's going to be fine. And I could just see myself just barging right into working with an adult the same way I would with a preschooler of like, we're playing, we're having fun. And now it's time to practice these skills, sort of just totally letting it wash over my head that this is not the same aged individual. They have very different, different rights and different needs. And I'm just sort of blanking on them. Do you have like an onboarding process for staff when they come in, or do people learn by making that mistake and then they get a lot of feedback to start? Like what is there like a process there?
Absolutely. So a lot to unpack there. I think the first, answer is yes. We have a lot of practitioners who have a great deal of experience working with children in school environments who come into adult services and are, completely caught off guard by the difference in working in the adult field versus with school-age children. And, it's exactly what you're referring to. The realization that comes first is often like, oh, adults aren't just large children, right? It turns out the needs of these populations of humans are entirely different, which it's crazy to me that this still continues to be a revelation, but it is. And I think, it's one misconception, I think, that has kind of led to the lag, in innovation and evolution of adult services in particular, is that people just kind of assume that, the strategies that work with kids in schools will just carry over to adults. And the other thing is not only is the client base, fundamentally different in a lot of ways, but the job is different. Right. So I find that clinicians working with adults are expected to wear far more hats than clinicians working in schools. In schools, while there is some variation, I find most behavior analysts often work in kind of a consultant role where they're supporting other educators, teachers and other related arts instructors. They get to kind of focus on the clinical aspect of their work, while there's still, of course, always paperwork and administrative functions to complete. The bulk of their time is spent focusing on ABA and, training and implementation and fidelity. Whereas, adult service providers really have to be jacks of all trades, jacks and Jills of all trades, where they have to understand how to do Medicaid billing in a lot of cases and function as a case manager, almost in a social work capacity, and understand, the intricate functioning of transportation systems and how to encourage, potential employers to hire their clients and, again, how to, juggle all of these really complex kind of controversial issues that we've already been touching on, like, the balance of the need to develop habilitation skills with, personal liberties. And again, working with adults who are of legal age, who should have the right to do adult things.
Yeah. And I've got to admit that, I was like of a similar mindset as you were. I was like, I grew up professionally, primarily working with kids. And to me, like behavior was behavior, whether you're a kid, you're a teenager or an adult, it's still behavior, still maintained by various functions. But I've got to give props to Chris, and I don't give him a lot of props, I've got to admit, but I do have to give him props because he has done a wonderful job of kind of teaching me the differences between kids and how it's important for us to like make accommodations based off of like the needs of the adults versus simply assuming, oh, these are kids and this is how we've done things there.
I think that kind of leads to my next question in terms of developing treatments and sort of your overall look at, how are we developing research? How are we developing treatments? Have you found like a significant shift in sort of how you plan treatments or how you plan research in a way that you might not have in the past, say with children or with adolescents, in terms of, I have to make sure that my treatment is reaching a need that I never thought would happen. Like I have to include more social validity, or, I have to focus on, with the job interview skills, right? That's not something, if you're working in elementary school, you're too worried about, how do kids present themselves at their, I don't know what interviews the kids do. None, right? So,
no, you just set up your lemonade stand. There's no interview required for kids,
You're a business owner when you're a child.
That's right.
Yeah. I think from a research perspective, definitely seen, some of the difference that I've seen is, obviously number one is the targets, right? So you mentioned the job interviews, like little kids, they're never going to do job interviews, but so it's primarily for, teenagers and adults there. But I think the other thing that I'm learning as well is, some of the other considerations that maybe I didn't spend as much time thinking about when working with kids. For example, in the stereotypy study there, one of the things we learned is that, although the DRO was a very, very effective treatment and the participant liked the treatment, and it was a bit stigmatizing because, this was actually conducted in his workplace, which was a gym, one of the campus, actually multiple campus gyms. And in hindsight, it is weird, giving an adult a little piece of candy. Right. So like that is probably something that I've learned that we should do differently to try to minimize any stigmatization that might occur. Stigmatization that might occur as a result of our treatments there.
Mm-hmm. And so, I obviously couldn't agree more with Sungwoo that we have to be extremely cautious, right, about using edible reinforcers, about having staff in an inclusive community environment, standing there with a clipboard, staring at someone from arm's length while they're working. And then I would also kind of push back a little bit, right, and say that in a lot of circumstances, we don't have a lot of powerful reinforcers at our disposal that will be strong enough to compete with the motivation that the individual has to engage in maladaptive behavior, right? And, often for us, at least, because we're not just subjectively and arbitrarily determining like this stereotypy must go, we've determined that it's impeding that individual's ability to succeed in an environment. We're making kind of a calculated decision saying, hey, this isn't ideal. Obviously, we don't want to compromise this person's dignity. But if we don't do this, he's going to lose his job, right? He's going to be asked to leave this environment. He's going to be the butt of jokes or, be embarrassed without maybe even being aware of it for engaging in this behavior. So that's kind of the complicated dance that I was referring to earlier, where, there's no easy, perfect right answer. And it's got to come down to, having a great team around you of other like-minded clinicians with a sound ethical compass where you can kind of, talk through these things and make sure you can get some, consensus with good, behavior management committee.
Mm-hmm. Wouldn't it be nice if we didn't have to train our clients to not engage in stereotypy, but we could train the community to be okay with seeing stereotypy in the workplace and being like, that's cool, and then moving on with their life? I wish that is what we could be focusing on sometimes.
Yeah. Totally. But, that's, I think, what the newer, term neurodiversity is attempting to hit at, right? Is where,
Right.
Society at large kind of evolves to a point, where, eccentric or, other types of behavior that stick out, aren't, things that, need to be eradicated or, completely diminished, and that it doesn't result in that individual being at a disadvantage for success in society, which of course is kind of like the social definition of a disability, right? When that stereotypy no longer results in that person being disadvantaged just by way of engaging in that stereotypy, then we'll be at a place where it won't even have to be a consideration. But one of the things I like to say is that, at Rutgers and at the RCAS, we're all advocating, for our society and the world to adopt more of a philosophy of neurodiversity, but we're preparing our clients and participants who we support to succeed in the world the way it is today.
Yeah, and I think that's important. It's like, until that happens, right? The individuals that we work with will still need our support so that they don't get fired. They don't have someone call the police on them. Right. And so, like, these are things that we're trying to prevent from happening for these individuals there.
And there are still aspects of one's job that you need to complete, right? That's what you're going to keep your job, is because you have to do that job. So that's part of that measurement as well, I would think, is how well can the person complete their job independent of whatever additional behavior may be occurring. But, related to what you were saying before, Jackie, you said part of what I was going to say as well. But it's such a complex consideration here. And, I started in adult services too. And so I have a real soft spot, I think, for this population because they're so underserved, they're under-resourced and under-researched as well. And whenever my students tell me that they might work with adults, I say absolutely go for it, because it's really rewarding. And it's also, even if you don't end up staying with that population, I think gives you such an important perspective if you're later working with younger kids as to what's really important for these individuals to learn over time so that they can, live whatever type of life they want to live as an adult, right? And I think that having that direction in the way that you're planning or helping to plan for that client long term, it can be really, really change the direction of how you think about things, right? So, you guys are saying, oh, well, you don't teach a kid, job interview skills, right? We don't focus on vocational skills until they're 14 or whatever it might be. But there's important components of those skills that you might actually have the forethought to begin planning for earlier on when you are thinking long term about what's going to be. I tell everyone, like, I love teaching picture schedules, not because I need kids to follow a picture schedule as a kid, but it's a lifelong skill. It's a cusp, right? Being able to follow a schedule is such an important skill. And that can take you all the way through all of these different vocational aspects. And I follow a list every day, right? We all do. I'm bad at asking questions. I only make statements.
I'm thrilled to hear that, you're actively encouraging your students to get involved in adult services. And, I would say, even for practitioners who are working in school settings with school-age kids, even if you don't want to actively work in adult services, like, you should be interested in advocating for additional resources, services, and research for adults, because, school-age practitioners are working so hard to help the children that they're teaching every day. But if you know that those children are going to grow up, right, and have, just these horrific outcomes in terms of quality of life in adulthood because, kind of the resources and services just completely evaporate after, the expiration of their IDA funding occurs, then, like, why bother? And again, like, I'm not trying to, discourage, teachers from working so hard, but just like, I would say everyone should have an interest in advocating for this at the very least. And again, I do know that, teachers have their hands full, and stuff in schools is far from ideal too, in terms of resources and ratios and time. But again, if you're looking at that first grader, that you're really just killing yourself trying to do the best job you can to help them learn and ultimately succeed every day. And, that if something doesn't change, that they're likely going to be unemployed, socially isolated, probably have half the life expectancy of a neurotypical adult living in the US. Like, that has to give you pause and motivate you to get involved in advocating, for a better kind of continuum of care for, autistic people after age 21.
But I think that kind of like the other side of that is also, getting like graduate students or just, people within our profession interested in working with adults. And so, people who are coming into our program, the vast majority of them are, saying, yeah, I want to work with kids with autism, right? So that they're focused on the kids and the children. And I think, that might be in part because, number one, they never really thought about working with adults as an option. But number two, that there probably aren't as many jobs in working with adults, right? There are tons and tons of jobs working with kids, but I don't see as many job advertisements or postings for adult-focused programs there. And so, I'm hoping that, as we see more job opportunities develop working with adults, that we also start to see more graduate students coming in saying, hey, I want to work with adults. But again, that's something that needs to kind of grow over time.
Before we continue our conversation with Dr. Sungwoo Kahng and Dr. Christopher Manente about advances in treatment for autistic adults, why don't we take a little bit of a break, and then we'll be right back.
Do you want to be a BCBA?
Sure, we all do.
Now you can come to Regis College in Weston, Mass. to get your graduate degree.
Choose from any one of these courses.
Masters of Science in Applied Behavior Analysis.
Masters of Science in Special Education.
Dual degree in Special Ed and ABA.
Or be eligible for your postmaster's certificate.
You can complete your degree and be ready to sit for the exam in 2 years. And our 2017 grads had a 100% pass rate on the BACB exam.
Come enjoy practicum placement support, ethics mini handbooks, PhD-level professors, small class sizes, and a service trip to Iceland.
If interested, don't delay. Supplies are limited. Learn more at regiscollege.edu.
Again, that's www.regiscollege.edu, regiscollege.edu. One more time, www.regiscollege.edu. See you there!
And we are back talking with Dr. Sungwoo Kahng and Dr. Chris Manente all about advances in treatment for autistic adults. But before we get back into that discussion, I want to remind all of our listeners that ABA Inside Track is ACE approved. By listening to the show, you're able to earn 1 learning credit. All you need to do is listen to the show, then go to the website at abainsidetrack.com/getceus, GET-CEUS, or click on the link in the show notes. You're going to need to enter in some information, though, including 2 secret code words that we've hidden in the episode. These are special guest code words. Not sure which guest had which code word, because I had to step out of the room right before they decided them. But I'll give you the first of those right now, and it is a 2-word code. It is prickly pear. PRICKLY space or no space PEAR. Prickly pear. That's like an expression. I think, is that the fruit that comes off a cactus? I actually don't know what a prickly pear is, other than your first code word. Prickly pear. All right, let's get back to the episode. So let's get into some of the research articles and sort of, drill down into how so many of our, the bigger topics we started talking about kind of can look in the small, with the individual or the small group participants. I do want to start with Jack and his stereotypy. And Sungwoo, you already mentioned, Jack a little bit earlier in terms of he was a employed individual. He was working in multiple gyms around the campus. But the challenge was he was engaging in somewhat high rates of kind of interfering stereotypy. And we talked about it a little bit, but I do think when we talk about adults, someone with a very, well-developed verbal repertoire, is holding, a job across multiple tasks, I sort of see stereotypy in the title and I think, is it really that big a deal? So would you mind kind of talking a little bit about how the decision was made, whether it was from Jack, whether it was in combination working with Jack or with the, adult service program, where it was like stereotypy, that's what we're gonna work on. Like, where did that decision come about?
He worked in a very public environment. Right. So this was pre-pandemic. So this was a gym, college. If you guys remember college gyms, they're packed full of students all day long there. And for him, I think it was the supervisors who got us concerned. And it's not necessarily the supervisors were complaining, but I think they were just expressing concern that, for example, on his breaks, he would go into the bathroom and start engaging in motor and vocal stereotypies while staring in the mirror there. And you'd have, like the other, the students walking around and just kind of looking at him in an odd way there. So I think, that raised our concerns about him, possibly losing his job. But I think also in the back of our minds, we were worried that someone might, find that as threatening in some way and possibly call the police. And one thing that we didn't include in this article is that, he was a young Black male. And I actually presented these data at the Missouri ABA conference earlier this year. And someone had pointed out that I probably should have mentioned that in greater detail, because as a young Black male, that adds additional risk if, obviously law enforcement were to get involved there, right? So we didn't highlight that as much. So, it was the possibility that he would lose his job, which he was great at and that he loved, but also the possibility of having law enforcement involved, which we did not want to happen there.
Yeah, and the other thing that's not captured right on paper sometimes is he was physically large in stature. Right. So part of the reason, why Jack worked at the gym is he loved to lift weights and work out. And, he's really athletic and a large, very strong guy. And also the specific stereotypy that he would engage in would be really intense and abrupt and, just be very disruptive. It's hard to miss in a public setting. So I think, all of those things combined with the fact that we started getting kind of those subtle, implicit, concerned comments from his supervisor is that we thought it was in, Jack's best interests. So I think what we're touching on too is as behavior analysts working with adults, we often have multiple competing moral and ethical obligations that we have to weigh. And just like what Sungwoo was communicating, one of those moral and ethical obligations that we have is to help the people we support actively avoid punishment contingencies, really severe punishment contingencies that are present in the natural environment. Again, losing your job, having the police called, or, worse peripheral outcomes that can result, from those situations.
It definitely is. I think, Jackie, you kind of mentioned this. It would be nice to say, and the treatment was, we told society to take a break and deal with it, and it all worked. But that's not that's a long-term plan.
This is something we want to be approaching from all angles.
Yes.
Right? And I think that is an important, bigger picture piece. But what I'm hearing from you two is that it was really important and valuable to Jack to keep this job, and that was in danger, even with talking to his supervisors and trying to explain it, because it was a pretty disruptive behavior.
Yeah.
Yeah. And, Dan, that's a great point, is that, this isn't like an either or situation, right? It wasn't like, you have to either treat them or educate everyone else. It was both. And I think, the great thing about the RCAS team is, they are so good about advocating for, the people with autism, that they spend a lot of time, talking to their supervisors at the gym, to the staff, so that they are aware and accepting of features of autism there. But that also means that there's no way that of the hundreds of students that come through the gym in a given morning, that we can educate every single one of them there, right? So that's where we need to, help support Jack in that particular situation as well. So it's really, everything that we can possibly do to help Jack be successful in that situation there.
So in terms of, the overall treatment, I mean, I think you do a nice job in the introduction, sort of, reviewing, here's some treatments for stereotypy. There's always RARD and, DRAs and DROs. And you eventually kind of went with the DRO. Now, in the questions I sent, you might have seen this one already, but Jackie hates DROs. So I was just imagining her reading this article, just the flames, coming out.
She's been trying to put DROs on extinction for several years.
And I think to be exact. Mm-hmm.
So you explain it very well in the article, but would you sort of mind sort of going into why did you choose DRO? Because I think you put in some thoughts into why that was the treatment of choice that are, I think, very specific to the fact that Jack was an adult rather than because DROs are just the best and everybody loves them so very much. That was
Yeah, we wanted to go old school, so we decided to use DRO. But you mentioned RIRD, which is, I know it can be a very effective treatment, but that is a treatment that we definitely thought would not, fly in a gym, right? That would just stick out too much. So that, we nixed that. We wanted a reinforcement-based treatment, but we also wanted, something that was relatively easy to do so that the staff could do it. It was much easier for the staff. So that's kind of like where we, just settled on the DRO. I think when we first kind of thought it out, we thought we could be more discreet with the DRO, right? So perhaps just kind of slip them a little reinforcer here and there every once in a while. But again, in hindsight, we could probably need to figure something else out. Perhaps, use a token economy or something like that with more discrete, tokens to make things a little less stigmatizing for them there.
It definitely is. I think, and this is true for at least two, the food your article on treatment of food selectivity, and then for the decrease in stereotypy, where just the fact that it was an adult population really did seem to, I don't want to say unfairly limit, but did sort of limit which treatments were going to be. Yes, appropriately limit. That's a much better phrase than whatever I said. Who knows? But definitely, really informed treatment in a way that, if you're in a school, maybe it would, maybe this treatment won't be great in, the third grade classroom versus the, third grade OT session, but just a very different set of kind of questions you had to ask yourself, or potentially even have the participant ask. Yeah. Mm-hmm. Parameters. You have all the good synonyms, Diane.
Yeah, I can say that I wasn't angry when I read this article. I do hate the DRO. If any of my students bring a DRO to class, I put a big red X on it and tell them to do it again, because a lot of the times DRO are not function-based, right? It's just like a Band-Aid for whatever, right? We'll just put a DRO on it.
It's a BMOD Band-Aid.
Right? And so, that's really why I hate DROs, because there are so many other options most of the time. But with stereotypy, like you said, it is a really challenging behavior to decrease. And if you have to decrease it, right, if, like you said, you gave really great rationales for why it was appropriate, there really isn't anything else, right, that's very intrusive. So in this instance, I will have to say that if you had to do something, a DRO is an okay place to start. So everyone's going to be like, oh, because literally we have listeners that email and they're like, why does Jackie hate the DRO so much? She's so mean about the DRO. Because, in most places when we're trying to decrease problem behavior, it's usually not automatically maintained. So there are a myriad of things that we can do that are better than a DRO. But when it's automatically maintained behavior and you have to get rid of it, it's almost near impossible. So there's my caveat there.
So we're not going to get the red X on our paper?
We're not going to get the red X on your paper. My kids are not going to be like, remember that time? I can use a DRO here. I'm like, as long as you provide a good rationale. And you did. So thank you. But nice. Yeah.
If any grad students are listening, though, it's not going to work for you. You're not Sungwoo. You're not Chris. You're not getting away with it that easy.
So what I'll say, and I agree with you, right? So DRO, I think, does get overused. Sometimes you can use a more, precise strategy that kind of acts directly on, behaviors you're trying to diminish and replacement that you're trying to build. As you brought up, right? This behavior was automatic, and we also needed it to diminish fairly quickly. And, in adult services also, we're always thinking about trying to structure interventions as simply as possible for fidelity purposes as well, because, we never have an extra set of hands. Our folks can't walk around, with clickers and timers and clipboards or, even, web-based data collection apps all the time, and, we have an incredible commitment to, high treatment integrity. If we're going to, take the time to do an FA and establish what the function of a behavior is and put a plan in place, then we're going to be sure that the staff implementing that plan does so with fidelity. And, I do think that's another extra consideration in working with adults is, when you're out there at that, university gym and you're just surrounded by people you don't know in a crowded space and there are dynamic things happening all around you, you really want that intervention to be as streamlined and as simple to implement as possible, but, still have it be very effective. So I think that would be another reason why we didn't go for a more multi-component approach here.
So speaking of simplicity of treatment as well as procedural integrity and multiple staff, I think one of the nice things, I think more in the stereotypy study was just the number of environments. But with multiple environments, and I think this was mentioned frequently in the food selectivity study, you have multiple individuals providing the support and the treatment. How does one go about just trying to get across all these different treatments across all these settings in which you're kind of telling people don't be, obvious that you're taking data and using your clickers and doing these things? Is that just like a huge part of the day of just like going around trying to like hope people are doing things correctly? Because they're all over the place. It's not like they're all in one center. They're, supporting multiple adults in multiple locations with multiple treatment options or, treatment procedures are following. How do you manage? How does that get managed effectively?
I would say that, for our program at the RCAS, we do have a community center. So we have a beautiful space that we do work from as a hub. But you're absolutely right. All of our program participants are out and about all day long, all over Rutgers campus, which is sprawling. It, spans several municipalities even. And I think to speak to, the credit of our behavior analysts, they spend all day kind of doing rounds and popping in and collecting treatment fidelity data and making sure things are, going the way that they're supposed to be going. We also, have teams of graduate students, right, that we enlist to do that work. But it's definitely, again, it's one of the real challenges of moving the field of adult services forward. And I like to emphasize the word field because, again, I see it as a separate field of practice than, working with school-age kids. And that's why we absolutely need advocacy for greater resources and a greater focus on research, hopefully yielding more opportunities for career paths that, come with a good salary also. But yeah, that's an incredible challenge. And not to mention, remember, when the staff are out there at all of these different community environments implementing these procedures, they're largely expected to do so autonomously, right? Mm-hmm. So, the lowest level direct care staff we have working at our center, in a full-time role is a registered behavior technician, right? We don't have folks in full-time roles who aren't certified, right? Who have a good deal of training to make sound clinical decisions, at a drop of a hat. So yeah, there's no magic bullet, right, to just, solve that issue. But, there's no one that you can call for help that's just in the classroom next door, right? You are out there by yourself in a lot of situations. And sometimes, in scary, complex situations involving challenging behavior.
Does staff ever mention feeling more anxious in, say, a role working with an adult across all of these different environments where there are probably lots and lots of other adults nearby who are watching them? What are they doing? If something goes, quote unquote, wrong, oh no, everyone's looking at me. I'm supposed to be helping this person and I'm failing them. And now they're staring at me. And is that like an extra level of stressor or something that you work on with staff, sort of understanding that possible anxiety that, the performance anxiety that might come from being in just so many, community places with so many other adults who aren't necessarily expecting, oh, I understand, you're working with someone with a disability, they might behave differently or do something I'm not expecting. Is that something that you find yourself talking with people about, or is that a common stressor that you see sometimes?
Yeah, that's in the job description, unfortunately, and fortunately for some people who, really thrive on the fact that the job is very dynamic and unpredictable. No 2 days are ever the same, right? It's a big reason why I love working with adults in the community, frankly, is, I started off thinking I would be a school teacher, and just the repetition and consistency of that just, was kind of soul sucking for me. I have to be honest. Again, no judgment for folks that love that. But, for me, there's nothing better than being out in the community, not knowing what's going to happen when you start your shift, not knowing who you're going to get to talk to on a given day. You never know if the chancellor or the president of the university is going to come up and ask you what you're doing there and why you're there and who you're working with. And so your job is not only to be a spectacular behavior analyst, but also to be an ambassador, for our program and an advocate for adults with autism everywhere. And, you don't have to worry about, doing the right thing when no one's watching, because there's always someone watching. Like, you're out there. So you have to be firing on all cylinders all the time.
I have to give credit to Chris's team, because I think they do an amazing job of making sure that, their participants are, kind of mixed in with the other students. Right. So you keep in mind that this is a college campus. So these are all, 20, 21-year-old students who are young adults, which is roughly about the same age as many of the participants at the RCAS program. And so I think, Chris's staff are really good about making sure that they as staff try not to, stand out too much, so that, it is a true community feeling for their participants there.
I mean, I just remember similar to Diana, my first job in the field after college was in adult services. And I remember sometimes going out in the community and remember being told, here are your community cards. So if something goes horribly wrong, make sure that you pass these out so everyone doesn't think you're just kidnapping this poor, individual or doing something you shouldn't be. And I got so scared. It's your first job out of college too, so it's not like I was so worldly at the time, but I just remember that being something I was always very nervous about. I don't think I would be now. I'd like to think I wouldn't be now, but who knows? Being out in the community,
staff have those cards. For sure.
Good. They're good to have.
And there's, name of supervisor, and there's a whole kind of little informational disclaimer on the back of that card that says, hey, this person is, a highly trained, specialized clinical personnel, and if you have any questions about anything you've observed, please feel free to call this number right here.
I don't think my card said I was highly trained. They probably said, please take pity on this guy. He's trying really hard.
I think, but the commitment to community integration and opportunity is really, central to the mission of a lot of these adult placements, as it should be. And, I know we haven't outright referenced the Bannerman 1990 article. I hear it threaded all throughout here. And that's so much of what providing services for adults is finding that balance between they're a grown person. They have their own rights. They can choose to do this or not do this. With, I can see some skills that would benefit them in order to continue to live an even fuller and more independent life. And how are we going to, find the balance between giving them their autonomy and also trying to maximize additional learning opportunities within that structure. And it's quite unlike other places that we often work. So it is singular in its being its own field, like you said, Chris.
Speaking of Bannerman and possibly eating too many donuts, let's talk a little bit about Jason and his food selectivity. I was surprised. I mean, certainly looking at the introduction, the idea that food selectivity is not necessarily a problem that's just going to go away. If you look kind of at the data that's out there, the longitudinal data, someone who engages in food selectivity at a young age probably will continue to engage in food selectivity until they're older. But still, Jason was, I believe, 26, so an adult. And while one could say to all of us, hey, you need to get your vitamins. Hey, you need to have a balanced diet. In a lot of ways, many of us probably don't. I think I had 2 dinners tonight. I probably shouldn't have done that, but it just seemed like a good idea at the time. What kind of led Jason to, either self-enroll or be enrolled in this study, or to be, a topic of conversation that he might like to minimize his food selectivity? How did that come about?
Well, first of all, that was a great segue going from the donut to the food study. Wonderful.
Thank you.
But for him, I think this was from his mother. And so, the mother is very active in his care. He still lives at home. And mother, I think, is still the guardian. And so, she's the one who expressed concern about his very limited diet, both not only from a nutritional health perspective, but also from a social perspective, right? So, by him only eating like very limited food made it very difficult for them to have a meal together. And so, and that was, obviously a very important consideration. Like medically, health-wise, that's really important. But socially, we want him to obviously be a part of his family community and being able to sit down and have meals there. So that's why we decided to intervene, for him, primarily based off the mother's concerns about his being so highly food selective there.
Yeah, and that's his food selectivity was resulting in pretty severe conflict. If he didn't have access to food that was acceptable, it'd be a source of frustration for him, and he'd get upset. And like one of, I think, more interesting aspects of that case was, he had a job at a university dining hall, and a part of his job, he would get a free meal, right, at part of his shift. And he liked, just as an example, he liked peanut butter and jelly sandwiches, but didn't find the peanut butter and jelly that they would provide at the dining hall acceptable because it wasn't still in the exact kind of jar, right, that he was accustomed to receiving at home. It was becoming pretty disruptive and restrictive for him, and really taking up a lot of his time and effort thinking about, having to have the exact right ingredients all the time for his meals. So I think that's, the judgment call for us. Again, another case that, it's really not cut and dry, but, by a committee of folks that, again, we're all kind of balancing each other out and going through this, ethical, moral kind of dilemma together, we arrived at the conclusion, it was a good idea to help him with this.
And we had Dr. Kira Moore on not too long ago to talk about anxiety assessments. And she had an example similar to that, where it was started as a food selectivity issue, but it had become such a big part of this child's life that it really looked like anxiety about how he was going to get a meal that was satisfactory for him. And that was the point of intervention, because it seemed to be causing him distress.
Who was really interested too in developing, potential, friendships and relationships, and even like interested in developing romantic relationships at some point, and, had expressed that one of the things he would love to do is, go out on a date at a restaurant, right? And, this was something that he communicated that he wanted to do. So we also saw this intervention kind of ultimately supporting that long-term goal that he had.
That makes sense.
Yeah, I appreciate you both, describing that process, because I think it is one of those, on its face, you're like, food selectivity, hey, you're an adult, don't worry about it. But there's the social aspect of a meal. There's the possible anxiety provoking aspects of a meal that you both explained very well. They need to be taken into account in terms of, what is the pro and the con of this does require treatment, this does not require treatment. It seems like the treatment was overall, relatively low intensity and successful in a reasonable amount of time. So that definitely, really weighs in the pro column of things as well. Were you expecting that the treatment to go as well as it did, given sort of his age, given how long the food selectivity? I mean, I think he had some, you mentioned some like quotes, I think, in there, like never had it, never gonna eat it, or, something along those lines,
Yeah, I guess I was a bit skeptical, just because, it seems like most of the research on treating food refusals with like pretty young children, right? Maybe, teenagers, but really we didn't see any research with adults, who had that really long history of food refusal or being so food selective there. So I was, a bit skeptical that, that long history would really make it hard for us. It turned out obviously great for him and for his family, because he started eating and started generalizing to other, healthier foods as well.
Yeah, and a lot of that research that you're citing, also, utilizes escape extinction, and physical prompting, as a means of achieving those results. And, this is, a grown man in his mid-20s, and, those things wouldn't be physically possible and certainly not, ethical or safe, frankly. So I was definitely skeptical. This person's food selectivity, from my perspective, wasn't just about preference, but had kind of evolved as a part of his identity, right? Like he, would proudly, state how he didn't like eating vegetables, how he never would. He didn't think that eating vegetables, like he thought it was like a tough thing, not to eat vegetables. That, I think he even gave me the classic line that, salads are for rabbits, right? And
he's on the cowboy diet.
So.
Yeah. To some extent, I think you had your positive DRA, you had your kind of the negative DRA. So if you eat some or try some, and you shape that behavior, you get, I think, the croissant. There's an ice cream sandwich at one point, depending on the food. And then if you don't, well, you can go wash dishes. Seemed like the real no thank you chore. But I guess it was good that he either both wanted to have the croissant or wanted to have the ice cream sandwich, and also not a big fan of washing dishes. But he did need to be somewhat compliant with the overall task. Did he start making? I mean, and Chris, you mentioned like there was a sense of, I would sort of like to do this, even though I don't want to eat salads are for rabbits. I do kind of want to go on a date. I mean, did that come up more and more in the research? Like, was there a sense of noticeable like quality of life improvement? Like, I'm so proud of myself for doing these things as you were going through the research that it's not going to make it into the paper itself possibly, but.
Absolutely.
Nods all around. Yeah.
Absolutely. I think it was pretty transformational in terms of his relationship with his parents around meal times. And again, also at work, he started really taking part in kind of the ritual of lunch with his coworkers. And again, like he was working in a university dining hall. So, there's this enormous array of options that he had at his disposal. And, have to be honest, like, the Rutgers dining halls aren't just any dining. This is spectacular food, right? It's not, your typical college fare. Like this is like the fine dining of university dining halls. So he really, again, got an opportunity to become familiar with a whole culture of food that he had never had access to before.
So I think that kind of brings us to the last article, the interview skills. So that there's an article. Okay, that's an article. For adults by adults, right? You got to know how to interview. So in the process, we've got kind of an extension of some of the literature. I do appreciate one of the articles you cited was the job tips research, which is an article I found like a million years ago. And I didn't think anyone had ever heard of it or read anything or did anything with it. And then we did it on the show a little while back. And then I saw it mentioned. I put a big exclamation point next to it, like job tips. It's still around, I guess. They're still going on. That idea of a curriculum for teaching interview skills. But when you started that project, was it kind of on your mind, like manualized interview skills is not the way we want to go? We kind of do want to be looking at more individualized BST type procedures, or was that a kind of a happy accident that, when the results came out that the individualized BST seemed to work better than here's your cookie cutter, get a job approach?
Well, I think it was really based off need. So this project was with the college support program. So Rutgers has a college support program, which is also part of the RCAS program. But, for Rutgers undergraduate students who have an autism diagnosis, they can be a part of this program to help them succeed and be successful, with their college careers there. But I think, what we were finding is that a lot of these guys said they wanted to get jobs, but they had difficulty getting jobs. And, I know that there's some places where people will find them in jobs and just place them in jobs, right? So that's not how the real world works. And that's probably not how it's going to work for college students with autism. They're going to actually have to apply and interview and get those jobs themselves. And just kind of in looking at essentially the social skills of some of these individuals, is like, we're not sure if they're going to be successful in getting these jobs. These job interviews are going to be huge barriers for these guys to successfully get something, in their field of study there. So we started looking to see, well, what's out there in terms of, teaching people with autism job skills. And we found that there were a few manualized interventions, right? But as behavior analysts, I'm skeptical about manualized interventions just because it doesn't really take into account the individualized needs. And so as behavior analysts, we said, all right, well, let's see if our way of doing things, behavioral skills training, for example, could be a better alternative for these individuals there. So that's kind of how we got to that point there.
In terms of timeline, did the development of this research was this pre-pandemic? Was this mid-pandemic? Because there's a lot of video focus in there. Was that just you were seeing the sign of the times, or it was like, that's all we got right now? So
yeah, we knew exactly what was coming down the road. So we thought, hey, let's do this remote. No, actually though, but timing wise, as we were just about to get this study started, everything shut down. And so like our original plan was to do these in person. But then the pandemic hit, everything shut down. We, shifted remote. And fortunately for this project, we were able to, switch. We hadn't really started, so we could make that switch to remote, and it made sense. And I think in hindsight, the training, it was actually better remote because it was a lot more convenient for the participants. So, in part, thanks to the pandemic, we had to make that shift to remote.
So it was not you were just seeing the future being like that. What was that movie with George Clooney where his job is he fires people and they started turning all the video calls. You weren't just like it's all video calls from now on.
I wish I could claim that, but I can't. It was dumb luck, or I guess dumb unluckiness there.
I guess. So in terms of the development of the BST, I appreciate that the article really goes through what worked and then sort of the reflection on what didn't work. So, starting with kind of a group PowerPoint on like, here's how to do job interview skills and how maybe that wasn't a necessary step. And then you made it into the individualized piece with just varying levels of feedback. Now, is that something that as you were developing it, you sort of added more onto it? You took parts out, or that you had sort of a clear, like, we're going to go through these steps. We're going to have our error correction here, our feedback delayed, condition here. How did that genesis of kind of the treatment come about?
We intentionally used that sequence there. And our goal was really to try to see like, what's like the most efficient, the least labor intensive intervention or training program that we can use. And that's why we start with the group training, right? It's like, most people probably sit through some type of group training. They're told what to do. And then, it's like, good luck, right? But, as we know, that doesn't really work very well. We need more individualized intervention. But we thought, we should just throw in the group training just in case we get lucky. But for the most part, it really wasn't beneficial. And that's where we made that progression to, like less feedback, essentially to more feedback there. I think, long-term wise, as we continue to do projects on this, it would be great if we can, do some type of like web-based training. Again, you try to, maximize the efficiency of instruction there, but that's something that's, kind of further along the road.
I love the setup of the study in terms of having, the first and the last questions were always kind of the same. I was like, do you have any questions for me? Kind of, and like, tell me about yourself sort of things. And then questions, it was the same questions, but the participants were just instructed to talk like they were talking about something in their major. Did I read that correctly?
Yeah, we tried to. So like in all the participants had very different majors. Like some were in engineering, others were in social sciences. So we couldn't pick one topic. And the people doing the interviews, so our experimenters, weren't experts in those areas. So they couldn't really talk about physics, for example, very well. And so, we had these, like that, the same beginning and end, but then in the middle, we tried to have general questions that you might come across in a job interview, but we still try to vary those as well to try to give them, enough examples.
So you were working with like the career department's not the official name. I'm sorry, I can't remember the name, but you were working with individuals who had a lot of knowledge in this area to kind of help with the crafting of the questions. Yeah.
So one of our authors, Joe Scott, I forget his exact title over in the career development office, but he's someone who knows like the whole career development field, knows what to ask, what will be asked. And so he's the one that we really leaned on to kind of develop these sets of questions there. But then he was also very generous with his time to be kind of like that pre and post test interviewer for us there. So he was that novel expert that provided that before and after picture for us.
Yeah, I always love when someone's mentioned by like the job or their role in the experiment, when you find out who they really were. It's a fun peek behind the curtain. So thank you for sharing. overall, I think the results seems very promising within those questions, within the the amount of time did seem like a lot, but I know you already mentioned like the group design. Like if you ran this again, you may have just ditched it. I think one of your participants, left because he was getting bored with it, or
he was. Yeah, he found it too repetitive.
No.
Which is obviously we didn't want that to happen, but that information in and of itself is very helpful for us.
But most of the participants seemed pretty happy, although you did have two that rated themselves lower at the end of the experiment than at the beginning, and you kind of posited it might have been that sort of sense of, I thought I was great at this stuff until I did all this training and I realized I got a lot still to learn about job interview skills.
Yeah, and it was interesting because like each of the different participants came in with kind of like different attitudes, right? Like some said, "Yeah, I really need help. I'm terrible at this. I hate like coming into these very strange and novel situations, talking to people." And other people, I think, might have felt their abilities were a little bit better than they originally thought there. Mm-hmm. And so it was kind of interesting to see this mix. But again, you're kind of going back to how do we select these guys? Like these are all people who said they wanted help, right? So we sent out a call to all the students in the college support program who needed help with this. And so they came to us saying that they would like help with that.
I want to shout out to career development offices for any of you listening who are still in school. If you have a career development office that will do mock interviews or will tell you about the job process, please do go find them. I found that as an undergrad to be some of my favorite senior year activities was going to the career development office and talking about what does it mean to try to get a job, because it's not really a skill that you know how to do as a person in your early 20s necessarily. I mean, maybe you do, but
and it's a hard thing, right? Like it's like when you do job interviews, particularly if you've been in the field for a while, I think you get better and better at it. But I can't imagine. I don't remember what it's like to do a job interview when you're 21, 22 years old, right? It must be horrible.
I actually remember. I remember my job because they asked me a ton of questions and I had no idea what the words in the questions even meant. I just remember them being like, and one, I was like, right. And I had like a moment of frozen, and it turns out I was friendly enough that they thought I would do an okay job. But like, I didn't understand most of the questions, so I probably should have gone to see my career development people as well.
Yeah, but just imagine you're a 21, 22-year-old, college student who also has autism, right? So like that would be even more challenging there.
Yeah,
I was going to say there are a few areas, there are a lot of, ways that our society is structured that ends up disadvantaging autistic adults. But I would say, the standard job interview process like ranks right up there in the top 3 for sure. I can't think of kind of a gate that autistic adults have to pass through that is more kind of tailor-made to play towards all of the inherent kind of deficits that come along with the diagnosis of autism. It's like that whole process is that you have to just stand up in front of a stranger who you've never met before and connect with them, often via vocal communication, and connect with them on a personal level and convince them that you're a person that has value to add to their organization. So for us, it's such a critical skill for our college graduates to have, because it's going to mean the difference between them being completely unemployed or getting a career that's going to allow them to be socially engaged and live independently. Because the unemployment numbers for adults with autism pre-pandemic were staggering, right? There's estimates that, float in the like 80% range. 80% of the 5 million plus adults with autism living in the US were unemployed pre-pandemic. And, as a society, we all start getting worried when the unemployment rate, starts reaching double digits for the general population, right? So like 80%, I can't get over how staggering a figure that is. And I would say that the standard job interview is a big contributor to that, or the inability to pass muster in that standard job interview format.
Yeah, we brought this up in our previous vocational training episode, that the job interview very rarely reflects the skills that you need in the actual job, right? So
horrible predictor of future performance.
Yeah.
Like no whatsoever.
Yeah. So I think, we talked about, what are some things that we could, strive for, maybe have someone try to do aspects of the job to see how well they would do, and maybe not necessarily talk about who they are as a person, but demonstrate the behaviors that would be indicative, right, of the actual job. But that's really not how it is at the present moment. So again,
right.
A better world versus what we have right now.
I mean, do you think we're seeing a shift? I mean, certainly with the move to a lot of things going to Zoom or, being online, I would like to think that might make it slightly easier. The way I have my camera set up here, I'm looking at all of your faces, but I think you're all seeing like the top of my head, I think, from where my camera is. And I'd like to think that you're assuming like, oh no, Rob's paying attention, he's listening, as opposed to like Rob's messing around on his computer and just totally ignoring us right now. So maybe it takes that eye contact piece out of the equation a little. I mean, is there any sense that the online interviews are making things easier for autistic adults, or it's just, nope, same stuff, different format?
Yeah, that's a good question, right? And I can see that there will be a trend to more, like with these online or virtual interviews, but how that benefits people with autism, I guess that's really an empirical question, right? Like, would they do better in a remote interview versus an in-person interview, even without training?
Master's thesis.
Yeah, it's interesting that you say that, because we actually did have one of our master's students actually just examine kind of a need to, find ways of increasing engagement through virtual instruction. Actually found that students that were expected to engage virtually had trouble, stay attending and not being distracted by other things in their environment. So I don't know that there's a perfect solution or alternative to, what we've created as far as like the primary step in getting a job in terms of the standard job interview. And as we've said, it really has, pretty low predictive, validity. So it's just unfortunate. That's just the way we do things.
Well, I think this is a good time to move into the last segment of our show, the Dissemination Station. Ooh, here we are. We made it. So, certainly I think sometimes when we have episodes where we talk about, research where it's not like, take these 3 articles and here's one big point you can take from all 3: food selectivity plus virtual job interview training plus stereotypy treatment, and you're not going to have one big conclusion from it. So I think what will make more sense is to sort of talk about what's next at the center, what's next in terms of areas of most desperate need for adults in terms of research, in terms of supports and treatment, and then how can people get involved? So why don't we start with sort of what's next in terms of most important need, or your opinions on what's the most important need for adults with autism right now?
Well, from my perspective, I think it's just more research in general, right? And so like the 3 papers that we talked about today, they're very different in terms of the targets and the interventions, but obviously the common theme is that they're all with adults. And the fact that, there's not really that much research with adults, it's from a graduate student's perspective, it's awesome because there's so many opportunities for master's theses and dissertations there. Whether it's, simply replicating already evaluated interventions with the adult populations, or targeting behaviors that might be more specific to adults, that's just a lot of opportunities, for more research there.
I would also just kind of echo something that I said earlier on, is that people just need to get more involved, honestly, in advocating for this population, and for this, to become a more formalized field of practice, right? Not just, something that someone happens upon and decides to stick around for a while, but we really need to create a pipeline of, the best and brightest early career practitioners who want to specialize in doing this work. And, if there's not a job opportunity in working with adults with autism, figure out how to create one, right? And if you work with adults with autism in existing settings and the standards of care are not adequate and the outcomes aren't good, then again, find more resources. Don't take no for an answer. Be scrappy. right? And again, if you're someone who's, spending their career supporting kids in schools, start tracking your prior students and figure out what they're doing in adulthood. So even if you have no prior experience in adult services, start thinking about, what the outcomes of your own teaching are across the lifespan for your former students.
I like that last point, Chris, in terms of what can folks who are working with sort of younger adults, so adolescents 16 to 22 kind of ages, when a lot of the educational benefits vanish into thin air. Like, you'd think there'd be something to come after them, right? But is there sort of one area, tracking and following up on students? I love that idea as a way to sort of get your own data as to what is it that we could have done back when you were here in school. And now I'm hoping that you're in an area where you have those kinds of services. But if you could think of something that you would tell an individual working with that population, kind of the high school aged individuals with autism, is there an area that you could say, I can guarantee you need to do blank 100% more than you're doing right now? Or is it really individualized per, area of the country, or,
It is individualized geographically and by person. But what I'll say, universally speaking, that practitioners working with transition age kids need to do more of is really focus on transferring stimulus control from, the explicit, salient behavior analytic token systems that they're using to the natural contingencies of reinforcement that exist in the whatever environment you anticipate that individual will be going to, right? And so, not just transferring, stimulus control that, to the contingencies that exist in those environments, but making sure, the students can perform under, schedules of reinforcement that parallel what they're likely to encounter in the real world, in the natural environment. Because again, I still feel like, look, teachers have hard jobs, and there's still a lot of kind of can kicking that goes over. It's like, oh, well, next year, Johnny we'll fade that out next year. Johnny will really start coming under the control of natural supports at his hour-long job sampling, later on in high school. Well, if you keep kicking the can down the road, ultimately Johnny is 30 and still unemployed. And again, can't wait for the delayed reinforcement that is likely to be present in that natural environment versus, the token board that's right there and salient and in front of his face all the time.
That's a good point. I am increasingly a proponent of, I do not understand why we teach about 80% of what is in schools today to any student, regardless of disability or nerd level of neurodiversity. A lot of it just feels very much like someone told you this is important to teach, and someone decided we got to put this on the list of things to learn, and no one ever bothered to ask, like, who's going to use this later on? Like, is this really a valuable way to spend time? Like, how many things did you all wish you learned when you were in school about living as an adult that you had to learn as an adult in some terribly, aversive set of circumstances?
That's exactly why I like working with adults, because everything we do has consequences for that person's quality of life that day, maybe the next day, maybe next week if we're pushing it, but we are not ever chasing some kind of objective or outcome that is, preparing for some other objective or outcome, right? There is no school for the purpose of future school here. We are identifying, real outcomes in, natural environments where someone's going to be able to live their life, and we're making an effective change that's often transformational for that person. So for me, I hear people say how fulfilling it is, to, help a small child, speak their first word or, make their community. And I've done that. It's amazing. It's incredible. But again, there's nothing like, for me, getting someone their first job, and it's instantaneous life change, or like a few weeks later, they're holding up their first paycheck, right? And maybe the individual still doesn't even have a complete concept of the monetary value of that paycheck, but everyone around them's patting them on the back, and they all of a sudden are plugged into this naturally occurring kind of social network that is their community of coworkers. And again, with adults, we get to watch them grow and evolve over such a long timeline that we get to celebrate all of these milestones of, being an independent, successful adult that many people take for granted.
Very well said. Well, Dr. Sungwoo Kahng, Dr. Christopher Manente, thank you so much for being on the show tonight. Thank you for sharing all of, your research and your work that you're doing for us and for all the listeners. If folks want to reach out, ask questions about, working with adults, maybe they're interested in switching fields, improving their competencies, or just kind of want to know more about the research and opportunities that are out there or supports that are out there. Is there a place that they can find you both?
Both of us are at Rutgers University, and both of us, I think, are very happy to talk to anyone who's interested, whether it be, getting graduate training or I guess just getting, some type of fieldwork training.
Yeah, we're easy to find. Our emails are right up there on the web. And, the RCAS website is also an excellent resource to learn more about what we're doing in adult services. And that's rcaas.rutgers.edu. We also have a spectacular Facebook page, where we're giving, real stories and current updates about what we're doing in our program. And yeah, absolutely. Would love to hear from anyone who has an interest in learning more about the professional field of practice surrounding adult services.
Oh, excellent. And if someone were to, interviewed maybe to get into grad school or to kind of, work in the department, is there an interview question you want them to be very well prepared to answer?
What makes you the perfect candidate for this job?
And if they say it's because they care too much, is that like a bad answer? Or do they get a 3 on the scale? They just want to give till it hurts? Or, how's that rate? Is that one okay?
That's my favorite weakness. That's my favorite weakness. Yeah. My weakness question. I just care too much. Just kidding.
We want to say a big, big thanks to Dr. Sungwoo Kahng and to Dr. Chris Manente for being on the show tonight and sharing so much information about all of the work that they are doing and how that applies to many clinicians out there. We hope that more of you are increasingly interested in supporting adults with autism and supporting this type of work. It's desperately needed. If you're looking for maybe a change in field, maybe leaving the schools, heading out into the real world, yes, please definitely reach out to our special guests and, continue looking into these lines of research. I want to make sure everyone gets that last secret code word. It is Scarlet Night, SCARLET, space or no space, KNIGHT. And in case you did not pay attention very closely, the Scarlet Knights are the team at Rutgers. That's their mascot. So Scarlet Knight. So there you go. All right. We hope you enjoyed listening to ABA Inside Track. We'd really love it if you subscribed to the show. You can subscribe anywhere on Apple Podcasts, Spotify, Stitcher, wherever you like. We'd love it if you leave us some reviews. Tell a friend all about us. There are a couple other ways you can reach out to us. We're on all the socials as ABA Inside Track. You can go to our website, abainsidetrack.com, to find links to all of our previous episodes, places to purchase CEs, as well as links to all of the articles that we have discussed on tonight's episode. You can go to our YouTube page where you can find all these episodes with the YouTube subtitling feature. And if you want even more ABA Inside content every month, go to our Patreon page, patreon.com/ABA Inside Track, where for just $5 a month, you can subscribe to get access to our special guest Q&As and to vote on our live episodes, as well as to get discounts on our CEs at our CE store. If you'd like to go to our premium $10 level, you'll be able to access all of our quarterly book clubs, where we talk about a book for 2+ hours, all about a book related to the field of behavior analysis. At the time of this recording, we're going to have a poll. We should have actually just chosen our book for this coming month, but I don't know what it is. This is past Rob talking. The poll just went up a little bit ago, so I haven't seen the winners of the results. But in your future, then you'll know what book we just talked about. Going to the past, our last book was actually the memoir, Look Me in the Eye, about an adult with autism. So again, if you're interested in long-form discussions of books, as well as some extra CEs at no additional cost, join us on patreon.com/ABA Inside Track. And finally, you can always email us with comments, thoughts, feedback, whatever you like, at abainsidetrack@gmail.com. Thanks once again to Dr. Sungwoo Kahng, to Dr. Christopher Manente, to Jackie and Diana for all of their awesome answers to my questions on tonight's show. We couldn't make this podcast without a couple other special people, including you, the listener. We also want to thank Dr. Jim Carr for recording our intro and outro music, Kyle Sturry for his interstitial music, and Dan Thabit of the Podcast Doctors for his amazing editing work. We'll be back next week with another fun-filled episode, but until then, keep responding. Bye!